Okay, so no need to introduce any of us because both of you now know us as well. So I'm just going to fly through most of the things. So Monash University recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays its respects to their elders past and present. And then you know the two of us, and the best contact is by email. So if you have any questions, it's best to email us. But when there are the online exams, especially, I normally give a number so that you can contact me directly. And this is just the information for the Zoom session in case someone missed it. Now, I'm not, Audra, I'm not going to go over the Moodle site now. I'll go after we finish this, just so that we can relieve Sophie, but we'll do that after I've gone through the presentation. And there's a direct link to the grad cert. So this gives you an overview of the learning outcomes for the overall grad cert. And then the main learning outcomes here for RAD5109 is the body parts that we're now addressing. So it is looking at the pelvis, the lower limb, thoracic and lumbar spine. So that is the main difference from, for example, RAD5108. And then the resources, the Moodle site is the place where you will have all your resources. And as you are aware, we release the timetable on a weekly basis, and we try to do it on a Friday if we can. If not, it will be released at the latest by the Monday morning. But most of the time between myself and Tony, we get it released either Friday or maybe over the weekend. And then most of the material is presented in Moodle books. It has got a number of resources, including recorded PowerPoint presentations, links to ebooks, and so forth. And then the reading list that you are quite used to within the Moodle books, I try to link it directly to the page where you need to read for that specific week. And then on the Moodle site, there's also the study support, but I will show that once we go onto the Moodle site. Image manipulation software, I've discussed before, so Sophie knows that, and Audra, you know now the image manipulation software, so it remains the same. So we use that in the ISAP cases. The number of assessment has changed, so there's only 3 assessments now for this unit. So there's only one big exam during the exam period, but there will be 2 formative exams. So halfway through, so there will be, after 4 weeks, there'll be 1 formative exam. And then the last 4 weeks as well, there will be another formative exam. And the summative exam, we use the image manipulation software. And if you've forgotten, there is a video demonstration of the software. And then for the exam, there are specific login details for access to the image manipulation software. We've discussed this last year as well, Audra, so you might remember, but there's a link to the Collective Minds Radiology sign-up form. Tony, I don't know if you just quickly want to talk about this slide, just in brief.
Yeah. So this is actually a potential resource for you. It's not compulsory. It's not actually a formal part of the course or anything, but it is a useful resource. And it's, I guess I'm promoting it because one of my ex-students from many years ago who now works in Sweden is one of the administrators for this site. And he's actually would like you guys to get in and have a look at it and potentially upload some cases if you want as well. De-identified cases and all that sort of thing. But the site actually contains literally tens of thousands of cases, and its clientele, its users are reporting radiographers, radiologists, consultant radiographers, radiographers generally from all around the world, as well as some non-radiographer medical people as well, who make use of it, medical students and what have you. and they're able to upload cases, as I say, and then anybody's able to look at them and give feedback on them or give their opinion on them. And then you'll get feedback from other people about whether you were right or whether you were wrong and what have you. So it's really useful. And Darren, who's actually created a spot for this course where we can upload images and share with each other images that we might come across. Students who are enrolled in this grad cert can actually. So if you actually search, you'll find that there is actually a pigeonhole, if you like, for the grad cert images. So that's Collective Minds Radiology. There's a sign up sheet there which you have to do, and then there's also a sample case which you might want to click on and have a look at. I think you can get into that for free. Oh no, you've actually got to be signed up to have a look
Yeah,
at the
first sign up and then you get access to the sample case. And Audra, if you click on that link under the reporting radiographer sign up form, it will take you straight there.
Yeah.
Lovely, thanks.
Yeah. And the other link down the bottom there, Dr. Ian Cowan, was Ian's a radiologist that I worked with in Fiji some time ago when we were teaching radiographers from developing countries, Pacific countries, to interpret radiographs when there's no radiologist available. And so it's actually designed specifically to support radiographers, this particular website. But certainly anybody else could actually access it as well. It's a good teaching site, and you'll possibly notice if you go on and have a look, some of my slides reflect some of the work on that website with Ian's permission, of course, and some of the material was originally mine anyway. So you're welcome to go and have a look at it and utilize it to supplement your learning. So that's all I'll say about those for the moment. Thank you.
Okay, thanks, Tony. So this is just a summary of all the assessments. So there is the ISAP case. You'll have one exam, and then the clinical portfolio. So Audrey, you're already used to submitting the clinical portfolio as well. Now, last year, all of our assessments were competency hurdles, but this year only 2 of those are. So the online exam and the clinical portfolio. But the ISAP case, although it's not a competency hurdle, it's got a big value. It's 30% of the unit. So don't ignore that and think I don't need to worry much about it, because that will affect your final mark then for this unit. And then I've given the date. So the first assessment for this unit will be your ISAP case. And the 12th of April, if it's the Thursday, it's probably Thursday evening before Easter Friday that you need to submit the CAP report. And then the CR report is only on the 19th of April, simply because there's a week in between for the Easter holiday. Now, the ISAP case will be released next week. So from next week onwards, you can start working on the ISAP case to get yourself ahead of the game. And then the online exam is during the formal exam period, which will be on the 6th of June. So that online exam is now much more longer. So it's a 100-minute exam, and it will cover all the material. So there's 8 weeks of materials that will be tested. And that's why we will have 2 formative exams. So after week 7, there's one. And then after 11, there's another one, just to start preparing you for that exam. And then the clinical portfolio, that is the last assessment, and that will be, the deadline is the 19th of June, which is the final week of the university's formal assessment period. And then for the online exam and the clinical portfolio, because there are competency hurdles, you need to pass that at a minimum of 50%. So if you don't pass it the first time, you'll get a second opportunity to do that, but I'm quite confident you should be fine. Then there's a link to academic integrity. There is a compulsory module. I think this will be mostly sent to students enrolled in the first unit, which is 4502. So if you haven't received an email that you need to complete this compulsory model, you don't have to worry about the model because you probably would have done it last year as well. But if you do receive an email to complete it, then please do that, because at one stage you will struggle to get access to the Moodle site. And then just about AI, which is a big topic on the Moodle site, and under the support tab, there's also a link to what we call Learn HQ, which will give you more information around how you can use AI. You can use AI, for example, as you do research for the ISAP case, but you need to know how you must then reference that so that you acknowledge that you've used AI for that. But you can't use AI for your exam. You can't use AI for the clinical portfolio. And in SpecCon, so you can apply for a short extension of 2 days. If you apply for a short extension, you need to submit your application. So if the assessment was today, it must be submitted by 5 to 12 at the latest on that day to ask for a 2-day extension. Now it's 2 calendar days. So if you submit that, you don't need to provide a supporting evidence. However, and that normally gets approved very quickly so that you know you've got 2 extra days. You might say, for example, you needed to submit your ISAP case, you've had the flu, you don't feel well enough, and you think you can benefit from 2 extra days, that you can do. The same link can be used if you need longer extensions. So if you need more than 2 calendar days, then it becomes a formal application, and you need to provide supporting evidence, whether it's like Tony, who had a car accident this morning. So if he was a student on his way to write an exam and he missed the exam, and might have to apply for more time because of that, might have had a bit of an injury and is in hospital, then you apply for a formal extension and you need to provide supporting documentations, a doctor's letters, or maybe a police declaration about the accident or something taking place. So the ISAP case, as explained, has got 2 parts to it. You've got the clinical action plan. Now, we've increased the word count from last year. So the overall word count is now 2,000 words, but we've made the increase on the clinical action plan, which is 1,500 words. And the comparative report is still at 500 words. As I mentioned, the overall weighting 30%. And because you're postgrad students, you're only allowed 1 submission. So once you submit to the Dropbox, it automatically gets integrated into the Turnitin software matching process, and it will then spit out a similarity index. And for the university, the similarity cap, the index is 15%. And as I mentioned before, if it's more than that, don't go into panic mode. I go in and I will see if there's any evidence of plagiarism, and 99.9% there isn't, because sometimes it matches. If you've repeated the question, it will match it. Sometimes it does erroneous things. It picks up the title or something like that. So most of the time students are okay, but make sure when you write that you do write it in your own words as well. And then once you've submitted the CAP report, which will be on the 12th of April, so at 12 o'clock that evening, once the deadline has been reached and you've submitted your CAP report, the expert report becomes available. And you then use that expert report to compare and contrast your CAP report with the expert report, and then write up a 500-word comparative report. And all what you need to include, that will be in the ISAP Moodle book as well. Then the online exam has got the biggest weighting, so it's a 40% weighting. It is a competency hurdle, so you need to pass it. So if you don't pass that first instance, you'll get a second opportunity to write another exam, and then that will be capped at 50%. And these are the materials from the weeks that you will be tested on. And I've also put the weeks where you'll be undertaking the 2 formative tests. And I would encourage you to do those formative tests because it really helps to show you the types of questions and exam questions that can be asked. And then also I give normally video recorded feedback on the formative tests. For the exam, the image manipulation software will be used. The exam is available, so the date for that exam is on the 6th of June. Ensure that you take time off. I know a lot of the postgrad students, because I normally monitor what happens on the day, and I can see when students log on quite often, it seems like they've just come from work, put their bags down and quickly logged on to do the exam, because I can see they haven't done anything before that. But give yourself time. This is a much longer exam. So if you can try and get a day off before the exam, that would be brilliant as well. The exam is available from 8 in the morning, but you need to submit it before 8 p.m. that evening. It will close automatically at that time. And then in terms of exam monitoring, so there's an academic integrity statement once you open the exam that you will have to accept. And then also you need to email me, and normally I send out notification of that to let me know a suggested start time so that I can send you the login details for the Moodle exam as well as for the image manipulation software. The clinical portfolio, as I mentioned, the deadline for that is on the 19th of June with a weighting of 30%, and it is a competency hurdle as well. And all of that material will be under this week. So there is a link to the clinical portfolio and all the supporting documentation as well. So for this unit, which focuses on the pelvic girdle, lower limbs, thoracic, and lumbar spine, you need to collect 25 clinical cases and write that up. So the word count has also now been increased for the clinical portfolio. Before it was 1,500. It's 2,000 now. So each case more or less around 80 words. But don't stress with the 80 words because some of your cases might be less, some might be a little bit more, but overall it should be around 2,000 words in total. And then each case will be worth 4 marks, which in total gives you 100 marks for the clinical cases. And then if you want to use a reference, it's not essential, but you might have a very interesting case that you've come across and you want to add a reference. That's always beneficial to do that. But as I say, it's not compulsory. And then the second submission is a self-auditing preliminary image evaluation record. And that's where there's a table that you then put in all of your information in terms of whether you can indicate that you identified everything normal. It correlates with the radiologist, which is true negative, or that you picked up the pathology correlates with the radiologist, which is a true positive. And then also if there's a false negative or a false positive, and then you're required to calculate sensitivity, specificity and accuracy. So specificity is how good you are able to exclude pathology, so you can identify the normals. Sensitivity is how good you are at picking up the abnormals, and accuracy is your overall image interpretation capability, if I could put it like that. And then just a brief reflection on your personal abilities. And it could be a case of where you identify that you still struggle with pediatric cases, and that's an area that you want to focus on, or you overcall maybe quite a lot in a certain body region. But in your reflection, you can mention your strengths, things that you have improved on a lot, or areas where you think you still need to improve a bit. And normally that is only a few sentences. It's not a long thing that you need to write. So for the self-auditing PIE record, you need to include cases of all the body regions included in this unit. And remember to also include normal cases. If you don't have enough, if you only include like 2 or 3 normal cases, it will affect your specificity if you get something wrong on the normals. So make sure that you include enough normal cases as well. And the other important thing is number your cases from 1 to 25, because when I give feedback, it's very difficult if there's no numbers, because when you get to number 12, I have to go and count which cases I'm talking about. So please number each of those. And then with each case, also add under each case how you've assigned your self-auditing, whether it's true positive, true negative, or false positive or false negative. And then sometimes there might be 2 pathologies and you only identify one, and the radiologist actually picks up on something else, and then you need to use fractions as well. But remember, each case, when you add all of that up, must be equal to 1 for that case if you assign your true positive, true negative, and so forth. And then once you've done all of that in the table, add it all up. And when you add all of it up, it should actually come to 25 if you've got 25 cases as well. And then calculate sensitivity, specificity, and accuracy. And when you submit your clinical portfolio, you will have to accept the academic integrity agreement to indicate that this is totally your own work. I've given here an example of the clinical portfolio. So of a case, so here's an ankle, a patient that's been referred with pain and swelling of the medial aspect whilst kicking a ball. And the main thing is you need to include with each of your cases at least one de-identified image. Now, with this case, the preliminary PAE was that there's a Salter-Harris type 4 fracture of the left medial malleolus and anterior teardrop sign, which indicates joint effusion and significant soft tissue swelling. So when the student compared it to the radiologist's report, it was mainly consistent. However, where the radiographer said it's Salter-Harris type 4, the radiologist stated it's a Salter-Harris type 3. So there's a discrepancy there. And this is then when you use the fractions. So for this one, the fractions was true positive, 2/3, and false positive, 1/3. So work it out for yourself. And the other important thing is radiologists might mention some of the information that's not answering the clinical question. So if the clinical question is, has there been a fracture, there's an injury, but the radiologist adds more things around, there might be some chronic changes there as well. You can ignore the chronic changes if it's not going to affect the patient management at all. So just make sure that you answer the clinical question. And that's about it for, so I'm just going to stop share there. And then Sophie, I just want to ask you, have you got any questions? Because we went through the clinical portfolio last night before we let you go. And then I'll quickly go over the clinical portfolio with Audra.
Yeah, the only real question is, do we use a similar layout when we're composing the portfolio to what was just up on the screen, like in that table format?
Yeah, you will use the same format. If you go on the Moodle site under week 1, you will see there's a link to clinical portfolio. And if you click on that, that is a Moodle book. You will see there's supporting documentation. So you go through all of that and there's examples there as well. And also the form that you can use for RAD5109.
Yeah, all right, lovely.
Okay.
Yeah, no, that's pretty much the only question that I really had.
Okay, all right. And so if that's it, we're going to release you.
Yeah, sounds good.
All good for the rest of the evening's work.
Thank you. See ya.
All right. Okay. Bye, Sophie. Thanks for joining. Okay, so Audra, do you have any questions following that introduction? So you would have noticed that there are differences now, and the main differences actually comes with the assessments. In the others, we had 2 exams. Now we've only got 1 exam. Is that a future radiographer?
There you are. Maybe. Yes, I'm a physio actually, so
Oh, physio, sorry.
trying to steer him that way. Sorry, I'm solo parenting. My husband's away at the moment. I'm in a meeting. No, sorry. No questions from me. That seems very straightforward.
Okay.
Sorry.
Do you want me to go over the clinical portfolio? Because that would be very much the same as what you've been used to. There's no changes there with the clinical portfolio, apart from the fact that there's an increase in word count.
Yeah, no, that's good to know. I know the word count. That's yeah.
Yeah.
Sorry.
And then maybe what I will do is maybe just share quickly the Moodle site with you. Just maybe that would be helpful.
Yeah, because that's quite different, isn't it?
Yes, it's very, very different to what it's been before. So under the unit dashboard, let me just go back to unit dashboard. So there it will normally indicate, so this week we're looking at week 1 content, but this is also where you will find anything that's been posted. So it will be posted under forums. So if you have missed out and want to check if you've missed out any of the information that was communicated, this is where you'll be able to see when was the last stuff sent through. So communication is now via forums. And then in terms of the unit information, so you probably had a look around. So there's a direct link to the handbook. I'm not going to go to that now because I think you are used to the handbook. And then the timetable. So if it happens that we need to update anything in the timetable, I will put updated and put the date next to that. But normally I also send a notification that there's been a change in the timetable. We don't think there will be any changes. I think myself and Tony, we've now sort of sussed out, we're happy the way the timetable is running, but you never know what can happen. But if there's any changes, we will put a notice there. And then this is just an assessment summary, and it just shows you the 3 assessments. And also that the ISAP case is not a competency hurdle, but the other 2 are. And then also the library links, and you're used to those library links. So I'm not going to click on any of that because once I click, then I have to stop and so restart again. Are you happy with that, Audra?
Sorry, just trying to unmute. Yeah, no, that's good. Thank you for that. That's good to see. Everything's slightly different, but still
But it's still kind of there. Now,
Yeah.
you were used to under assessment that we posted all of the information. As you can see, there's nothing there. So the assessment taskbar is one of the areas that is a bit of a frustration at the moment with the IT team who has developed this a new format. Sometimes you will find assessment appear, sometimes it don't. But what we will be doing, if it doesn't appear there, the assessment, the getting started has got all of the information. So here you can see it has a summary of all the assessments, and then also a link, information about the clinical portfolio as well, and letting you know the first assessment is due on the 12th of April. So if we find that, for example, the exam doesn't appear under assessment, we will put it under getting started, but I will let you know where to find stuff if it doesn't appear, because the assessment taskbar, as I said, is a little bit, it's not working as it should, because I sometimes find something is duplicated for some of my other units under assessment, and then there's nothing there for some of the other units. And the other thing I just wanted to show you is the support taskbar. So under the study support, this is the Learn HQ that tells you more about artificial intelligence, and then also the student academic integrity. If you need to do that, there is a direct link here also if you need to apply for an extension. So anything under the study support that we think students need, you will be able to access from the units as well. So you don't have to search to find out where something, how you can apply for something. Just go to study support. And then under the library, there's, you could, if you need one-on-one support with the librarian, which I don't think you need, but anyway, there's some meetings you can set up around referencing, and then also some work, library workshops that they offer. And then some other stuff as well. So Monash Connect. I don't think you will need that for this unit, but you never know if something happens. And for example, you find you cannot complete the unit and you need to contact Monash Connect as to how you can discontinue. Just in this example, I don't hope it will happen with you. And then English Connect is disability services. And then also for our campuses outside of Australia, and then also for technical support. So say, for example, you are struggling to access Moodle suddenly, there's a direct link to eSolutions as well. So you can contact them, get the contact details from there. So there's a lot of stuff under support that you can directly get now from your Moodle site, which is a very good change to the Moodle site. And then under learning, you will find, so at the moment you can see only week 1 content is available there. So for this week, most of your materials will be under own time. So own time means, although the material is there, you can work it at your own pace or when it suits you. Real time, the only time that there will be real time is tonight, because real time is when we have face-to-face sessions. So if we go to real time, you will see it has the introduction session. And what I will also do is once we finish, because I'm recording, I will be posting tonight's recording also here under real time. So the main one that you will have to look at is basically own time, because this is run online completely. And that's about most of it. So as more weeks become available, this will expand. Okay, so that's about it. Yeah, have you got any questions that you would like to know about the Moodle site that you might have struggled with, Audra?
No, I think that covers it all. Thank you for that. Good to know the assessments. You know, it's going to be a bit different, but that's cool.
It might be that it works by the time we need the assessment taskbar. But like last night's one showed the clinical portfolio stuff, but tonight there's nothing under 5109. So for some reason, it's a hit and miss at the moment, but I will be checking if the information doesn't come up there. I will then put it under getting started, because that always shows, and I will send an email to say this is where you will find the information.
Perfect.
And then as always, Audra, you know, if you've got any issues, if you struggle with something, you can always contact either myself or Tony, because we're here to support and guide you and make sure that you are successful, and especially for you with your final unit. Yeah, so I really wish you all the best with this one.
Thank you. I appreciate that. You guys are a great resource, so I will, be in touch if there's any issues. Thank you.